Well, let's get more now with Mathilde Vu, who is the advocacy manager for Sudan at the Norwegian Refugee Council. And she joins me now from Brussels, but was recently in Sudan and left on April the 12th. Great to have you, Mathilde. And we heard from the WHO in the past few hours that 60% of health facilities now in Sudan's capital are closed. We're hearing about the thousands that are expected to flee. What kind of pressure will this put on agencies such as yours and also the people that are remaining there in Sudan?
Yeah, thanks for having me. It's going to be a humanitarian catastrophe. What you have to understand is that 2 weeks ago, before this whole war happened, Sudan was already living an extremely high humanitarian crisis. And as your colleague said, there was 4 million IDPs in the countries, 1 million refugees. There was already 1 person out of 3 needing humanitarian assistance. Now there's been an urban warfare. There's been actually airstrikes on residential areas. There's been looting. There's been heavy fighting in the streets where people live, where people have their schools, where people have their hospitals. So you can, I mean, what we can imagine is beyond what we ever had before in Sudan. And the humanitarian needs are going to be extremely high, and it's going to be extremely complex as well to respond.
Incredible. As you say, even before the fighting already, 1 in 3 needed humanitarian assistance. How easy is it for you to get in touch with your colleagues there in Sudan, and what are they telling you?
It's becoming more and more difficult to be in touch with our colleagues for a few reasons. One is a lot of them are trapped. They're trapped in Khartoum, in the capital, and they're running out of everything. They're running out of food. They're running out of water. They're running out of electricity. They can't charge their phone. On top of that, the network is breaking down more and more, so it's more and more difficult to be in touch. And a lot of them are trying also to make the very difficult journey out of Khartoum and to a safer place. And this journey comes with so much cost when it comes to, there's the emotional cost, there's also the financial cost, because it's actually very expensive to try and find fuel or a bus that is able to take them outside of this nightmare. And it's also like it also has a risk itself, because it means perhaps being caught in a crossfire, getting out of the home and be caught in the middle of fighting. So more and more difficult to be in touch with them. But when we call them, they all are they're terrified with what is happening. They don't know what's going to happen tomorrow. They also are very very worried for their country and for the people who are in need in their country. And a lot of them have actually highlighted that what is going to happen to all the people who are already displaced, all the people who are refugees, and who we cannot support at the moment.
Mathilde, there's been evacuations of foreign nationals, and they're still continuing. Does that help or aid then your work? I mean that from the political pressure that can be put, on the warring parties to actually stop the fighting.
That's a very good question, and I think that's a dilemma for a lot of people. Of course, any organization has a duty of care, responsibility, and it's the same for the Norwegian Refugee Council, where our priority first was to ensure the safety of our colleagues, and so some of them may need to be evacuated. However, what is important is for humanitarian organization to continue to commit to support Sudan. And as you said, we need eyes on the ground to be testing, to be able to see what is happening, but we also need arms on the ground to be able to support whenever the assistance is resumed. And that is a big call of the humanitarian organization in working in Sudan, is that we need to set up a large-scale emergency response, and we need to do it yesterday.
That's an important message to end on. Mathilde Vu speaking to us there from the Norwegian Refugee Council, live from Brussels. Really appreciate your time today on this important story, crisis in Sudan. Thank you.